Don't drink olive oil alone before bed, at least not without understanding what actually happens next. Mixing it with the right ingredient may support digestion, heart health, and even blood flow relevant to men over 50. Mixing it with the wrong one or the wrong medication can cause real problems that most videos on this topic never mention. Here's what most content online gets wrong. It either oversells olive oil as a miracle cure for testosterone and vitality, or it skips the actual mechanism entirely and just tells you to drink it. Today, we're reviewing what the evidence actually says about 5 common nighttime pairings, how strong that evidence really is, and exactly where the popular claims fall apart. Before getting into what to mix it with, it's worth understanding why olive oil is the base ingredient in the first place, rather than any other cooking oil. This isn't arbitrary. Extra virgin olive oil has one of the strongest evidence bases of any dietary fat studied for cardiovascular health. It's rich in monounsaturated fats and polyphenols, plant compounds linked to reduced inflammation and improved blood vessel function. Multiple large studies, including decades of research tied to the Mediterranean diet, have found regular olive oil consumption associated with meaningfully lower cardiovascular risk, including reduced rates of heart attack and stroke in populations consuming it regularly as their primary fat source. This matters directly for men over 50 since cardiovascular health and erectile function share the same underlying blood vessel mechanisms. Healthy blood flow depends on flexible, responsive arteries, and anything supporting that system indirectly supports erectile function too, since an erection is fundamentally a vascular event. This is a genuine association from strong research, not a guarantee of improved performance from a nightly spoonful. The effect is cumulative, built over months and years of consistent intake, not a single dose before bed. Before going further, a quick safety note that applies to everything in this video. Olive oil is calorie-dense, roughly 120 calories per tablespoon, and several of the pairings we'll discuss involve acidic or pungent ingredients. Men managing acid reflux, gallstones, or taking blood thinners or blood pressure medication should talk to a doctor before starting any regular oil-based nighttime routine. This isn't dangerous for most healthy adults, but it isn't universally appropriate either, and a few specific combinations carry real interaction risks we'll cover directly. The most common pairing recommended online is olive oil with fresh lemon juice, taken before bed. This combination has real roots in traditional and folk practices, particularly around liver and gallbladder support, but the modern clinical evidence is considerably more limited than most videos suggest. The specific claim that olive oil and lemon together flush the liver or dissolve gallstones is popular online, but this is not supported by strong evidence. Some small studies suggest this combination may promote bile flow, which plays a genuine role in fat digestion, but there's no robust clinical evidence it removes gallstones or provides any meaningful detox effect. Clinicians generally consider gallstone treatment a matter requiring medical evaluation and, in many cases, procedural intervention, not a home remedy involving oil and citrus. What is better supported is the more modest general digestive comfort some men report with this pairing. Olive oil has mild natural laxative properties, and combined with lemon's acidity, some people notice easier morning bowel movements. This is a genuine, if mild, practical benefit worth knowing about. It is not a liver cleanse, and no combination of foods clinically detoxifies your liver, since your liver performs that function continuously on its own regardless of what you drink before bed. Here's the simple version of what's actually happening. Bile helps digest fat. Olive oil may stimulate mild bile release. Lemon's acidity may support that process further. This can ease digestion for some men. It does not detoxify your liver in any clinical sense, and it does not dissolve existing gallstones, which require medical treatment. A second common pairing is olive oil with raw honey, and this combination has slightly different, better supported reasoning behind it, though not for the reason most videos claim. Honey has documented antimicrobial and soothing properties historically used for coughs and throat irritation with moderate evidence, including some support from clinical guidelines for its use in short-term cough relief, particularly in adults where standard cough suppressants aren't preferred. Combined with olive oil, this pairing is sometimes used for occasional throat discomfort or mild respiratory irritation rather than any hormone or vitality-related benefit. This distinction matters since some marketing implies this combination directly supports testosterone or male vitality. That specific claim isn't supported by current research. Honey and olive oil are not established testosterone-boosting foods, and no credible clinical evidence connects this pairing to hormonal changes in men. Where this pairing genuinely helps is more mundane than the marketing suggests. Easing an occasional scratchy throat before bed, particularly useful for men who experience nighttime throat irritation from allergies or mild acid reflux. Men with diabetes should be mindful of honey's sugar content if using this regularly, since it can meaningfully affect blood glucose depending on quantity. We're now roughly halfway through, and this is the point where evidence quality drops noticeably. This matters because most videos on this topic blur this line entirely, presenting every pairing with equal confidence. Everything discussed so far has genuine, if modest, research support behind it. What comes next relies more heavily on tradition and biological theory than confirmed clinical results in humans, and it's worth knowing that distinction before trying any of these. Olive oil combined with raw crushed garlic is another popular nighttime combination, sometimes marketed specifically toward men for vascular and prostate support. Garlic does have genuine research behind it for mild blood pressure reduction and some antimicrobial activity. Several controlled studies show modest, measurable blood pressure improvements with regular garlic consumption over weeks to months, an effect linked to garlic's sulfur compounds supporting healthy blood vessel relaxation. The leap from garlic may modestly support blood pressure to garlic and olive oil, restore male vitality, or reverse erectile dysfunction is not supported by strong evidence. Garlic's blood pressure effect is real but modest, generally in the range of a few points of systolic pressure, and mixing it into oil before bed doesn't meaningfully change or amplify that underlying mechanism. This is also the pairing carrying the most significant interaction risk on this list. Men taking blood pressure medication should be genuinely cautious with regular garlic supplementation, since combining the two can occasionally cause blood pressure to drop lower than intended, leading to dizziness or lightheadedness. Garlic also has mild blood-thinning properties, meaning men on prescribed blood thinners like warfarin should discuss this combination with their doctor before making it a regular habit. Since the combined effect on bleeding risk hasn't been thoroughly studied and caution is warranted, raw garlic before bed can also cause digestive discomfort or acid reflux in some men. Worth noting if you're already sensitive to spicy or pungent foods at night. Olive oil combined with a small amount of cinnamon has genuinely interesting moderate strength research behind it, specifically around blood sugar regulation rather than any direct vitality claim. Cinnamon has shown modest, measurable effects on insulin sensitivity across several controlled studies, particularly in people with elevated blood sugar or early insulin resistance. This connection matters more than it might initially seem for men over 50, since insulin resistance is directly linked in research to reduced testosterone and impaired blood flow through the same vascular mechanisms discussed earlier in this video. This isn't a stretch or a marketing exaggeration, it's a genuine research-supported physiological connection. That said, the effect size from a small nightly dose mixed into oil is modest, not dramatic, and this isn't a substitute for addressing blood sugar through broader diet activity and weight management. Men with diabetes on insulin or other blood sugar medication should check with their doctor before adding regular cinnamon intake, since the combined effect could meaningfully lower blood sugar and require a dosage adjustment to their existing medication. Before we move to the next point, if you want the broader health picture organized in one place, Dr. Emily Carter's Guide, The Iron Age, the complete blueprint to reclaiming testosterone, strength, and vitality after 40, was written for exactly this kind of question, connecting nutrition, blood flow, and hormonal health into one clear framework. It's a concise 14-page guide with 9 focused chapters covering testosterone, strength, energy, and vitality after 40. It's priced at $49.99, and you can find the link provided with this video. It's educational, not a replacement for medical care, but it gives you a clear framework to work from as you sort through claims like the ones in this video. Returning to the evidence itself, a fifth pairing worth covering is olive oil combined with turmeric and a small pinch of black pepper, a combination that's gained real attention in nutrition research over the past decade. Turmeric contains curcumin, a compound with meaningful anti-inflammatory properties documented across a substantial body of research, including some evidence relevant to joint health and general inflammatory markers in the blood. The reason black pepper matters here and why this specific combination shows up together so consistently is genuinely mechanistic rather than tradition alone. Curcumin is poorly absorbed by the body on its own. Piperine, the active compound in black pepper, has been shown in research to significantly increase curcumin absorption, in some studies by a substantial margin. Olive oil adds a third layer since curcumin is fat-soluble, meaning it absorbs considerably better when consumed alongside a fat source rather than with water alone. This combination has moderate evidence for reducing general inflammatory markers with consistent use over time. Since chronic low-grade inflammation is increasingly understood to contribute to reduced testosterone and impaired vascular function, this represents a reasonable indirect connection to the concerns most men watching this video actually care about, though it's worth being clear that curcumin is not a direct testosterone treatment and no credible research supports that specific claim, bringing together the caution points across everything discussed. Men taking blood pressure medication should be cautious with garlic specifically, given the interaction risk described earlier. Men with diabetes on insulin or blood sugar medication should check with their doctor before adding cinnamon or turmeric regularly, since both can affect blood glucose. Men on blood thinners should discuss garlic and turmeric specifically with their doctor, since both carry mild blood thinning properties that can compound with prescribed medication. Anyone with a known olive allergy, while genuinely rare, should avoid this approach entirely. And anyone with active gallstones or a diagnosed gallbladder condition should speak with their doctor before trying the olive oil and lemon combination specifically, given its effect on bile flow. Here's the point that matters most, and it's rarely mentioned in videos covering this topic. Timing before bed specifically doesn't add any unique physiological benefit beyond convenience and habit building. There's no research showing nighttime consumption of olive oil or any of these pairings provides a meaningfully different effect than taking the same combination earlier in the day. If nighttime works better for your routine, that's a completely fine reason to do it. It simply isn't a biological requirement, and you shouldn't feel like you're missing some special nocturnal window if mornings work better for you instead. Bringing this together clearly, since we've covered 5 different pairings with 5 different evidence levels. Olive oil itself has strong evidence for cardiovascular support, built cumulatively over consistent long-term use. The lemon pairing has limited evidence, useful mainly for mild digestive comfort rather than any liver cleanse. The honey pairing has moderate evidence, but specifically for throat comfort, not testosterone or vitality. The garlic pairing has modest blood pressure evidence, alongside real medication interaction risk worth taking seriously. The cinnamon pairing has moderate blood sugar evidence, relevant to hormonal health indirectly through insulin sensitivity. The turmeric and black pepper pairing has moderate evidence for reducing inflammation, with a genuinely well-understood absorption mechanism behind why the combination works better together than any ingredient alone. None of these combinations treat erectile dysfunction, low testosterone, or prostate disease directly, and none should be understood as a substitute for medical evaluation when symptoms are persistent. If you're experiencing ongoing symptoms in any of these areas, that requires a conversation with a doctor, not a kitchen remedy. Warning signs worth taking seriously include persistent erectile difficulty, unexplained fatigue, urinary symptoms that don't improve, or any new abdominal pain, particularly relevant given the gallbladder-related claims discussed earlier in this video. These deserve medical evaluation, not continued self-treatment at home. A 6th combination worth covering is olive oil mixed with a small amount of apple cider vinegar, sometimes taken as a nighttime shot diluted in water. This pairing has attracted significant attention online, particularly around claims of fat loss and blood sugar control, so it's worth separating what's actually supported from what isn't. Apple cider vinegar has moderate evidence behind it, specifically for modest improvements in post-meal blood sugar response. Several controlled studies have found that vinegar consumed before or alongside a carbohydrate-containing meal can blunt the resulting blood sugar spike, an effect linked to acetic acid slowing carbohydrate digestion and improving insulin sensitivity slightly. This connects to the same insulin-testosterone relationship discussed earlier with cinnamon, giving this pairing a genuine, if modest, indirect relevance to hormonal health in men. Where the evidence weakens considerably is around claims of significant weight loss or detoxification from this specific combination. Some smaller studies have found modest appetite suppression and small reductions in body weight with regular vinegar consumption over several months, but the effect size is small, generally a few pounds over an extended period, not the dramatic transformation often implied online. Combined with olive oil specifically, there's no research showing any amplified or unique effect beyond what vinegar alone provides. A genuine safety concern here that's frequently left out. Undiluted vinegar is acidic enough to damage tooth enamel over repeated exposure and can irritate the esophagus, particularly in men who already deal with acid reflux. This should always be diluted in water, never taken directly, and men with acid reflux, ulcers, or swallowing difficulties should avoid this pairing or discuss it with their doctor first. A 7th pairing, olive oil combined with fresh grated ginger, deserves mention specifically for its evidence around inflammation and circulation, 2 areas directly relevant to the audience watching this video. Ginger contains gingerol, a compound with documented anti-inflammatory and antioxidant properties, and several studies have found modest improvements in markers of inflammation with regular ginger consumption over weeks to months. There's also some research, though more limited in scope, suggesting ginger may support healthy blood circulation through mild effects on blood vessel dilation. This connects conceptually to the same vascular health theme running throughout this video, though it's worth being clear that this specific research is preliminary rather than well-established, and no strong clinical trials have directly tested this combination for circulation benefits in men specifically. Practically, this pairing is most reasonably used for its more established benefit, easing occasional digestive discomfort or mild nausea, an application with genuinely solid research behind it, including support from some clinical guidelines for nausea related to motion sickness or mild stomach upset. Men on blood-thinning medication should be aware that ginger, like garlic, has mild blood-thinning properties, meaning this combination carries a similar, though generally milder, interaction consideration worth mentioning to your doctor if you're taking prescribed blood thinners regularly. Something rarely explained clearly in videos covering this topic is that not all olive oil sold in stores delivers the same benefits discussed throughout this video, and understanding this distinction genuinely matters if you're trying to apply any of these pairings for real benefit rather than just going through the motions. Extra virgin olive oil, the least processed form, retains the highest concentration of polyphenols, the antioxidant compounds most directly linked to the cardiovascular benefits described earlier. Refined or light olive oil, despite the name suggesting a healthier option, undergoes processing that strips out a significant portion of these beneficial compounds, meaning the research supporting olive oil's cardiovascular benefits doesn't apply equally to every bottle labeled olive oil on a grocery shelf. There's also a genuine, well-documented problem with olive oil fraud in the marketplace, where products labeled extra virgin are sometimes diluted with cheaper, lower-quality oils. Several independent testing organizations have found that a meaningful percentage of olive oil sold, particularly lower-priced options, doesn't meet the actual standards for extra virgin classification despite the labeling. Looking for a harvest date rather than just an expiration date, checking for third-party certification when available, and being appropriately skeptical of unusually low prices for extra virgin oil are all reasonable practical steps if you want to ensure you're actually getting the product the research is describing. I also want to address quantity directly, since most videos on this topic never specify an actual amount, leaving viewers to guess. Research examining olive oil's cardiovascular benefits generally used quantities in the range of 2 to 4 tablespoons daily, spread across meals as part of broader Mediterranean dietary patterns, not a single concentrated dose consumed alone before bed. This matters because a single tablespoon mixed with lemon, garlic, or any other pairing before bed represents a meaningfully smaller dose than what's typically used in the research showing cardiovascular benefit. This doesn't mean a smaller nightly amount provides zero benefit, but it does mean the dramatic claims sometimes attached to a single nightly tablespoon overstate what that specific dose, taken in isolation, is likely to achieve compared to consistent moderate intake spread throughout your normal diet. For any of the specific pairings discussed in this video, garlic, cinnamon, turmeric, ginger, apple cider vinegar, a reasonable starting approach involves small amounts, roughly a teaspoon of the added ingredient, combined with a tablespoon of olive oil, adjusted based on how your body responds, and any relevant medical guidance from your doctor given the interaction risks discussed throughout this video. One mistake I see repeated constantly in content covering this topic is treating these pairings as interchangeable, as though combining multiple ingredients simultaneously multiplies the benefit. This isn't how the evidence works. Mixing garlic, cinnamon, turmeric, ginger, and vinegar all into the same nightly dose doesn't combine their individual research-supported benefits into one super remedy. It significantly increases your risk of digestive discomfort, and it meaningfully increases the complexity of any medication interaction since you're now combining multiple compounds with mild blood thinning or blood sugar effects simultaneously rather than one at a time where the individual research actually applies. The more evidence-aligned approach is choosing one pairing based on what you're specifically trying to support: digestion, blood sugar, inflammation, or mild blood pressure support, and giving it consistent use over several weeks to months, rather than combining everything at once and hoping for a compounded effect the research doesn't actually describe or support. Setting honest expectations matters here too, since supplement and remedy content online frequently implies immediate results. For the cardiovascular benefits tied to olive oil itself, meaningful change is a matter of months to years of consistent dietary pattern, not something noticeable within days. For the more targeted pairings, cinnamon's effect on insulin sensitivity, garlic's effect on blood pressure, turmeric's effect on inflammation, research generally shows measurable change over 4 to 12 weeks of consistent daily use, not a single dose or even a single week of effort. This is worth understanding clearly before starting any of these, so you're not discouraged after a few days when nothing dramatic has changed, and so you're also not misled into thinking a single nightly shot before bed is doing more in the moment than the underlying physiology actually supports. It's worth briefly comparing olive oil to other oils frequently discussed in men's health content, since several videos online suggest alternatives that don't actually carry the same evidence. Coconut oil is often marketed as a testosterone-supportive fat due to its saturated fat content, since testosterone synthesis does require cholesterol and healthy fat intake. However, the evidence specifically linking coconut oil to improved testosterone in humans is weak, mostly based on small animal studies rather than confirmed human trials. Coconut oil also lacks the polyphenol content responsible for olive oil's cardiovascular benefits, and its high saturated fat content means most cardiology guidelines recommend it in moderation rather than as a primary daily fat source. Avocado oil shares some similarities with olive oil, including a comparable monounsaturated fat profile, and has reasonable, though less extensively studied, evidence for cardiovascular support. It's a reasonable alternative for cooking at higher heat, since it has a higher smoke point than extra virgin olive oil. But it doesn't have the same decades of large-scale population research behind it that olive oil does through Mediterranean diet studies specifically. This comparison matters because it reinforces something worth repeating. Olive oil isn't simply one option among many with equal evidence. It has a genuinely unique, extensively studied research base, which is exactly why it remains the foundation for every pairing discussed in this video rather than an interchangeable choice. Something rarely mentioned in content covering this topic is that olive oil's beneficial compounds degrade over time and with improper storage, meaning the same bottle can provide meaningfully different benefit depending on how it's been handled before it reaches your kitchen. Olive oil's polyphenol content decreases with exposure to light, heat, and air. Research has found that oil stored in clear glass bottles on a countertop near a stove loses beneficial compounds considerably faster than oil stored in a dark bottle in a cool cabinet away from direct heat sources. This means two bottles labeled identically as extra virgin olive oil, purchased on the same day, can differ meaningfully in their actual antioxidant content depending purely on storage conditions before purchase and after you bring it home. Practically, this means storing your olive oil in a cool, dark cabinet rather than next to your stove, using it within a few months of opening rather than letting it sit for a year, and choosing dark glass or tin containers over clear glass when purchasing, all genuinely affect whether you're getting the benefits described throughout this video or a degraded version of the same product. A few other olive oil claims come up frequently enough in this space that they're worth briefly addressing directly, even though they fall somewhat outside tonight's core topic of nighttime pairings specifically. Topical olive oil for hair or skin is sometimes promoted alongside internal use claims, but this is a genuinely separate application with its own mostly limited evidence base, distinct from anything discussed in this video regarding cardiovascular or hormonal health. Claims that olive oil alone significantly raises testosterone are not supported by strong evidence. What the research does support is olive oil's role in overall cardiovascular and metabolic health, which indirectly matters for hormonal health given how closely testosterone production is tied to overall metabolic function rather than any direct hormonal mechanism from the oil itself. It's also worth addressing the claim that olive oil should completely replace all other fats in your diet for maximum benefit. The research actually supporting olive oil's benefits comes from broader dietary patterns. The Mediterranean diet specifically, which includes olive oil alongside fish, vegetables, legumes, and moderate wine intake, not olive oil consumed in isolation, while the rest of the diet remains unchanged. This is worth understanding honestly, since it means the benefits discussed throughout this video are most likely to materialize as part of a broader, generally healthy dietary pattern, not from olive oil pairings alone layered onto an otherwise unchanged diet. Given everything covered today, 7 different pairings with varying evidence levels, it's worth offering a simple, practical way to decide which one, if any, might be worth trying for your specific situation, rather than leaving you to sort through all of this on your own. If your primary concern is mild digestive discomfort, the lemon or ginger pairing has the most directly relevant, if modest, evidence. If you're managing borderline blood sugar or insulin resistance, cinnamon has the strongest, most directly relevant research connection. If mild blood pressure support is your goal, and you're not on blood pressure medication or blood thinners, garlic has genuine, if modest, evidence behind it. If general inflammation is your concern, turmeric with black pepper has the clearest supporting mechanism. And if you're simply looking for the most well-established, lowest-risk starting point with the strongest overall evidence base, plain extra virgin olive oil on its own, taken consistently as part of your regular diet rather than mixed with anything else, remains the single best supported choice discussed in this entire video. So here's the bottom line. Olive oil, paired thoughtfully with the right ingredient for the right purpose, can genuinely support cardiovascular health, digestion, blood sugar regulation, and inflammation. And several of these pairings offer modest, real benefits worth trying if they fit your specific situation. None of them are a substitute for addressing testosterone, blood flow, or prostate health directly with a clinician when symptoms are actually present. 3 practical takeaways to leave you with. Choose extra virgin olive oil specifically for the strongest evidence base behind everything discussed today. Match your pairing to what you're actually trying to support, digestion, blood sugar, or inflammation, rather than assuming every combination does everything at once. And treat persistent symptoms as a medical question requiring evaluation, not an ongoing home remedy experiment. If anything discussed here feels relevant to symptoms you're currently managing, that's worth raising directly with your doctor. The Iron Age Guide is linked with this video if you want the broader picture. Thanks for watching, and I'll see you in the next one.